why do deep brain stimulation for Parkinson's disease? Well, despite large doses of medications, patients who have typical Parkinson's disease are experiencing off time. The medicine is not working and they're having more and more bad hours in their day. Or conversely, they're on so much medication that they're having disturbing side effects such as hallucinations or dyskinesias, these involuntary movements that most of you that have seen Michael J. Fox are familiar with. So the number of good hours is decreasing, and I mentioned the issue with side effects. Just to review how this comes about, when people are first put on medicine for Parkinson's disease, they take the medication at a certain time, they get the medicine in their bloodstream, it lasts over 6 hours, the timing isn't so important as to when they take the medication, and their day is pretty good because the medicine covers the whole day evenly. But as time goes on, the way the body handles the medication begins to change. And so over a number of years, which might be 2 to 5 or 6 years after you've been on L-DOPA, which is the main medication for Parkinson's disease, now when you take the medicine, it rises a little higher in the blood, but then it dissipates and maybe only lasts 2.5 or 3 hours before the patient loses the effect of the medication. And then as time goes on, not only does the effective period shorten, you have to give so much medication that now it peaks well above what the patient needs for control of their symptoms and gives them these extra symptoms of the dyskinesias or the hallucinations. So then it becomes a roller coaster for the patient. The medicine kicks in, they have to do things for the next hour, hour and a half before the medicine disappears, and they are not getting effect from it. Then they take their next dose. And it's difficult to manage as time goes on because you're having to take the medicine every 2 hours or every hour and a half in order to have an effective day. And if you're taking that many doses, you're beginning to experience the side effects. So when should surgery be done when you're looking at this picture? When does DBS, deep brain stimulation, have something very specific to offer? Early in Parkinson's disease, when it's mild, almost any medication works well. And many alternative medicines to L-DOPA are used to manage the symptoms during the first 2, 3, 4, or 5 years. Typically, by 3 or 4 years after diagnosis, patients need to go on the primary drug, which is L-DOPA, which is, the brand name is Sinemet, or most of people have what's called carbidopa-levodopa. The carbidopa is added to the levodopa to make it more effective. But somewhere, usually around the 6th to 10th year, the medication begins to wear off along the line of the previous chart that I showed you, where the medicine doesn't last long enough, so people are starting to have to take the medications. And then the doses start increase where they may be experiencing dyskinesias or hallucinations. When this honeymoon is over, when the medicine is no longer giving an effective coverage of the 24-hour day, that's the time that the window opens for deep brain stimulator to be helpful. The deep brain stimulator does electrically what the L-DOPA does pharmacologically, and so they can complement each other. When things keep going, and now the patient has only a few good hours in the day, other problems begin to develop. Because of the limited activity, the patient becomes deconditioned, so that their muscles can't respond as well, even with further help. And there, the deep brain stimulator doesn't really provide the robust help that it does earlier. So it's a window of opportunity that time-wise may be anywhere between the 5th and 12th year of the disease. The disease varies individually how fast it may or may not progress. Some people are very lucky in that they see very little progression over 10 or 15 years. Other people having serious difficulty with the disease and the medications after only 4 or 5 years. So we don't go by a specific year, we go by what the patient is actually experiencing in terms of identifying patients who would be good candidates for deep brain stimulator.